collaboration is critical for healthcare teams. The stories we've heard this morning exemplify that, of how important it is for patients to have a voice in the team with whom they're working, for nurses to be able to share information with doctors that doctors may not be privy to. Today, I want to share with you the science on effective teamwork and tips and best practices for patients, providers, nurses, and doctors to work together better. What I'm going to argue is that many of the problems that happen in healthcare teams and that can negatively impact patients, which is what we're all trying to avoid, come from one root cause. And that root cause is hierarchy. So when I say the word hierarchy, I mean vertical differences that set people apart from one another. It could be that someone has more power than another, or more status, a better job title. When people are in elevated positions, it changes the way they think, the way they view the world, how they interact. And if you're at the bottom of the hierarchy, it also changes the way that you think and act. It makes you more quiet, more introverted. These can cause huge problems. It can make you scared to speak up if you're at the bottom of the hierarchy. And if you're at the top of the hierarchy, it can make you miss things that are critically important to your team outcome. I'm going to talk today about the three main problems with hierarchy and how you can help to overcome it in the teams with whom you're working. So the three reasons why hierarchy hurts healthcare teams. And I want to give one caveat. I'm not necessarily saying we should throw hierarchy out the door. There is some utility in having a way to know how to make decisions. But cultures that are overly hierarchical can be dangerous. They inhibit voice. So problem number one, participation. When someone has more power than you, if you're sitting at a table with your boss, you hold back a little bit. It's just natural from what hierarchy does to us. But if you're trying to bring important information to the top to know exactly how a patient feels, how their disease is progressing, to know the conversation a nurse had with a patient, people need to be able to speak up, and a hierarchical culture impairs that. The second key reason why hierarchy is a problem is influence. And more often than not, we let people tell us what to do on the basis of things that don't have to do with knowledge, just because they have a job title, or they're taller, or more attractive, or have a deeper voice. We put ourselves in a smaller position, and we let them tell us what to do. And we need to be better at that, of recognizing expertise and making sure we're listening to the right people. Third reason why hierarchy causes a problem for healthcare teams is conflict. Then in a good team, you're having debate. People have different ideas. Patients have some ideas about the treatment they think they would like. Doctors have ideas. Nurses have ideas. You should be able to debate about that. Hierarchy makes this really hard. Again, it makes people hold back, but also when it gets really toxic and people get frustrated with hierarchy, conflicts get very political, and people are fighting for the wrong reasons. So to have a pure debate, hierarchy really gets in the way of. So hierarchy problem number one, participation. We know from team research, the 80-20 rule. If you're in a meeting with 5 people, so imagine 2 doctors, 2 nurses, and a patient, one person does 80% of the talking. That means one person, perhaps one doctor, talks 80% of the time, and the 4 other people in that room, the other doctor, the 2 nurses, and the patient, do 20% of the talking. Doctors have a lot of knowledge, but so do patients and nurses. And if they're not getting their voice heard, you're going to make ineffective decisions. So illustration of this. If you're the team leader, being in a business meeting or in the hospital room, you take up time. It's just natural. It's literally power changes your brain. You're not even aware of it. And it makes you want to speak more. But in order to make good decisions in teams, you have to learn to be able to hold back a little bit to lean out so that others can lean in. So I want to share with you some best practices of how to do this, but first a little bit of empathy, which is this is natural. This tendency that we have from hierarchy to lean in when we have power and hog the airtime comes from evolution. Back in the caveman days when we were hunting buffalo, we needed someone to tell us when to throw the spears at the same time. And to this day, we still have evolved a comfort with hierarchy. It feels sometimes a little bit strange to be in a situation where we're with true peers. That we like to have someone be a little bit more dominant. It makes other people be more submissive. It's very comfortable coming back from how we've evolved. So that being said, though, in the modern day, hierarchy doesn't help us make good decisions. So we have to combat what we naturally do to fall into rank, to try to actually be equals with one another in the ways in which we interact. Because everybody in the team has value, has voice, and that needs to be heard to have good outcomes. So how do you do this? I'm going to talk about this from the perspective of doctors, nurses, patients, researchers, postdocs, PhDs, anybody in a healthcare team. By far the most important way to equalize participation and get voices heard is building a culture of psychological safety. Amy Emerson at Harvard's amazing dissertation documented this as probably the most important facet of healthcare teams, of having a climate within a team where it's okay to make mistakes. It's okay to say something that isn't so smart, and it's really okay to have a crazy idea. So how do you build this climate? It comes from role modeling on the part of the leader. So at the top of the hierarchy, when someone offers a crazy suggestion or says something that you don't agree with, you don't punish it, you don't shoot it down. You acknowledge it, you incorporate it in the conversation, and you use it to build forward. Another way to manage this is if you're at the bottom of the hierarchy and the top isn't listening, you don't have a safe culture, how do you get your voice heard? So if you're going into a meeting with your doctor, how can you make sure they listen? So there's a lot of research on how to change the power dynamics in a situation in terms of your nonverbals, where you're standing, where you're sitting. So people listen more to people that are proximate to them. So when you go into the meeting room, sit in the middle of the table. Don't sit off to the side and let all of them sit close together. Sit in the middle of the people that you want to be working with. Next, think about your body language. Make yourself expansive, look more powerful, be bigger. I work with a female CEO, and every time she goes into a board meeting with a lot of older white men, she goes in early, claims 3 seats for herself, spreads out all the paper around her, so she's very visible in the center of the table, and everybody has to look at her. There's no way to avoid her having a voice. Also manage the way that you communicate. If you lower your voice, people take you more seriously. If your voice goes down at the end of sentences, people take you more seriously than if you say, teamwork is great, isn't it? Lower your voice. It helps. All these little things are easy ways to start to shift the power balance in the team to ensure that the doctors are listening, the nurses are listening, everybody's able to be heard. Other things that matter too. So if you're trying to manage a situation and you want to make sure that you have a voice or the people in your team speak up, don't convene a meeting that has 10 people, 5 or 6 people max. So as a doctor, don't have big groups. As a lead researcher, break off into subgroups if you need be. As a patient, try to avoid situations where there are going to be too many people in the room because it's just too hard to speak up then. Another way that helps is having data sent around before a meeting. So all the information that everybody has to share, if everybody knows it going in, you can help call out somebody who's not speaking up, or also for yourself, you're prepared enough to know how to speak up or when to speak up. Data's power. And the last one that goes for ongoing teams, so say in a research collaboration where you're working on the cure for a disease, how do you decide what course of action to take? Is it the senior researcher decides who's there most longer, who's most senior, who's most famous? Or is it who has the best data? In a good team where you have effective teamwork, the currency of debate, the thing that makes decisions, is the weight of data. And making sure that you have a culture in which this is a currency is essential for equalizing the hierarchy and enabling everybody to be able to speak up. Because if you have good data, you're allowed to speak up then. You don't have to have a fancy job title or be in the organization 20 years as long as you have good data. Okay, so moving on to problem number 2 of hierarchy, that's participation. Why participation is dangerous is who speaks most tells us what to do, yet who speaks most doesn't always know most. So we did a study at Stanford with very bright undergraduates. We had them play a desert survival game. They had to rank order items to figure out how to survive in the desert. They each did it on their own first, and then we told them their score. We then asked them to choose a leader. And guess who they choose the leader? Only half the time did they choose the smartest person in the room to be leader. These are very bright students. Yet half the time, they were persuaded by someone's attractiveness, their height, their facial features, their gender, and they let them lead the decision. Terrifying to think the things that we ascribe influence to. If you let someone lead simply because they have a lower voice and they have no idea what you're doing, in this study it meant you died in the desert. No one wants that. On the one hand, we can't help it. Again, going back to the caveman days, we've evolved to respect this. We've evolved to respect dominance and size, people that carry weapons and ride horses. And while this is an automatic tendency, it doesn't mean that it's a good one for healthcare teams and modern day decision making. So in the study that we did, this is what happened. The teams that chose a leader who was the smartest person on the task, who had the most knowledge, they performed better. They got out of the desert, they survived. Those teams that chose the leader who was more dominant, who had a deeper voice, more attractive, more persuasive, those teams didn't do so well. They didn't make it out of the situation that we put them in the desert. So when you're in a meeting and everybody's speaking up, it's critical to make sure you're listening to the right person. And that may not always be the tallest person or the person with the most seniority. It's the person that knows most about this particular situation. And that's the challenge of teamwork, is that's going to change moment to moment based on the discussion over who knows most in that situation. So what can you do to fix this? So I'm going to talk about the hippo in just a second and the hippo model of leadership. But first, you have to know who knows what. So it's critical in a healthcare team to know who has what information. It could be that you have a sports injury and you didn't realize that your nurse played sports in college and has really deep insight into that type of injury that you hadn't known about just from her specialty. So taking the time to check in with a team before you get into a discussion about who has relevant knowledge is critical, because otherwise you're going to miss important insights and give influence to somebody who actually doesn't deserve influence in that situation. Now, getting back to the hippo. So in order to do this, in order to have the humility to let someone other than the formal leader lead, it means the person in charge of the team, be it the surgeon, the head researcher, whoever's leading the meeting, they have to be a team player. And they have to be willing to let whoever knows most take the lead in that situation. Doesn't mean that you're not the leader or the formal leader, but it means that in that situation, you're letting other people have influence and rise up in their bases of knowledge. So I was working with the CEO of a tech company, and he had this great analogy for leadership called the hippo model. And he described himself as a hippo. I want the people in my company to have voice. I want them to speak up. And whoever knows most is able to lead that discussion. But it's hard for them when I'm in the room because, I am the leader. They look up to me. If I raise my eyebrows, they stop what they're saying. So I've learned to sink underwater whenever I want my people to speak up. And so I go around the office underwater, my little eyes up, monitoring what's going on. In the team meeting, I just have my eyes up. I'm letting them speak, letting them have a voice. If something goes wrong, if there's a crisis, if my team needs me, if we have to make a decision now, I rise up in my full hippo strength, and I come to save the day, because I am a very powerful hippo. Everybody still knows I'm the hippo, I'm the leader, but I'm very good at minimizing my presence and giving space and room for other people to speak up. So once you know who knows what in the team, and you realize the wealth of knowledge that people are bringing to the team, of knowledge of someone's condition, knowledge of day-to-day living with an illness, you can start to respect that and let that come out in the discussion by sinking underwater a little bit more than you usually do. So if you're in a leadership position, try this when you go back. Be a hippo. I dare you. And the last one I'm going to give you on this is an easy hack if you want to go home and try this immediately, is rotating meeting control. Let the patient run the next meeting rather than the doctor, or let the nurse run the meeting. Ideally, it should be whoever knows most for that situation, but if you just start to make a habit of realizing that formal leadership isn't the same thing as running a discussion, you make it easier to have a culture where people can speak up, and if they know something relevant, to take the lead. So to rotate meeting control based on what people know, check in with who they know what, and be a hippo. So the last challenge of hierarchy that I'm going to give you today is what it does to conflict dynamics in teams. So the conflict problem. Hierarchy makes constructive debate really difficult. In teams, you have 3 options for an atmosphere around conflict. We're going for the middle one of constructive debate, where I have an idea, you have an idea, we can discuss it and figure out the best course of action for this patient or for this research project. Often, teams fall prey to groupthink, which means we follow the blind off a cliff. No one says no, we all just keep going in one course of action, and we have a horrendous outcome. Happens a lot, and hierarchy makes it happen even more. Because what I mentioned about participation and choosing the wrong leader, if someone says go left and no one questions it and that person doesn't actually know, you're in deep trouble. Problem 1. Problem 3 in this is destructive debate. Once you start to realize the person that you've ascribed influence to and who's hogging the airspace isn't actually the best person for this position and they're not willing to take a seat back, you get conflicts over rank. People struggle for the top, people vie to have influence. It becomes much more about me versus you than solving a problem together, which is what we're going for. And so hierarchy causes a lot of negative things and makes it really hard to have a constructive debate. So you want to equalize atmosphere, equalize participation, equalize influence as much as you can and have a currency around data to get there. So again, groupthink's natural. We all do this. Problem number one, we fall prey to it, that we've evolved to like things that are similar to us, that are familiar to us. There's so much uncertainty in the world, and having people who agree with us, who think like we do, helps resolve that uncertainty, and it feels really good to have people verify our views of reality. The trouble is, in the modern day, it's good to be challenged. We don't like it, but it's good for us. So a study that was run at Stanford by one of my mentors, Margaret Neal, they had a team do a decision-making task. They asked the teams where people disagreed, they were dissimilar from one another in their views, how they did, and the team of zebras, how they did. Where everybody looked alike, those teams of zebras, they said, this was amazing. We did so well. We know we rocked this decision, and we're great friends. This is awesome. The team that had the zebra, the camel, and the elephant, and they weren't so sure about it. We disagreed. It was tough. It was uncomfortable. We didn't always get along. We don't know about this. But then if you look how they actually did, the performance of who had a better outcome, who chose a better course of treatment, the better strategy for the patient, the zebra, the camel, and the elephant did so much better. Having a culture of healthy disagreement is useful, and that means people having a voice, having leaders step down, and being able to trust and respect everybody in the team enough that it's okay to disagree. So what this looks like, constructive conflict. We know from tons of literature right now that constructive conflict is a good thing. It's a good type of conflict of how you can recognize it when you're talking about the goal of the group. So if it's what medicine to give a patient, what procedure to take in a surgery, what method to use in a research project. Those are good conflicts. If you're fighting about what time to meet, who's going to do what, I just don't like you, probably not a good conflict. So be certain of the topic. Also make sure that there's no emotions involved, because then it turns into an emotional conflict rather than a cognitive conflict about the strategy. Easy tips and best practices. The trouble, though, with these good conflicts is they're very hard to maintain. So we know from some of our research that 70% of good conflicts get hijacked by bad conflicts. So for example, there's a game that I love to play with my MBA students. It's like bridge, a card game. People learn the game at different tables. The winning team then goes up to the next table. They don't know that each table had different instructions about ace high or low. So they come and sit at the new table, and they have a disagreement. They try to play ace is high, and the other team says, no, ace is low. Everybody's first reaction in this situation is to make it personal, to say, you stupid person, you clearly didn't read the instructions. I know ace is high. And they waste a lot of time. I've had students walk out of the classroom. It's bad. What's also even sadder, though, is about 10% of the students say, well, actually, maybe I didn't read the instructions right, and I just don't understand, so I'm not going to say anything. But all these reasons are not the truth. They had objectively different information. Yet our automatic human tendency when people disagree with us is to make it personal, to make it emotional, and to turn it into something it's not. And hierarchy causes that, because hierarchy causes negative emotions, resentment, jealousy. So it makes it really hard to have one of those good discussions where you say, oh, you disagree with me because you have a different piece of paper than I do. You have different information than I do, and that's okay, and let's talk about that. Let's put the puzzle pieces together. Hierarchy makes that really hard. So how do you fix this? How do you have a good conflict in a healthcare team where you do have inherent hierarchy? Well, you want to flatten the culture. And one of the ways to do this is embracing diversity and cultural equality. So if everybody in the team has something unique that they bring to the team in terms of information, it's a lot easier to perceive each other as equals. If there's one rank order that's based just on how much education you have, it's a lot steeper hierarchy, it's going to be a lot more negative. But if you recognize, you know this about your patient, you know this about the treatment, and I know this about the situation that caused the accident, everybody has something to add then. So looking for diversity makes it easier to have a good conflict, and people are more accepting of disagreement and less likely to have it derail into something emotional. And once you're having a constructive conflict, you're having a debate within the team about what treatment to provide, manage constructive conflicts with care, because as I said, they go wrong pretty quickly. So one is be aware of emotions. And this is especially hard in healthcare because there are a lot of deep emotions involved. But once you become emotional in a discussion with your doctor or your nurse, you're not going to be your most rational or your most persuasive. So ask to take a break. Go out for 5 minutes for a walk, get a coffee, even do your meditation app on your phone, which is what I do if I get upset. But calm down, because the conflict's never going to work if there's a lot of emotions involved. So also choose the time and the place. If you want to disagree with somebody, make sure that you and them are going to be in a good place emotionally to have a good debate. And that's going to lead to a better outcome. The next one is when you have a debate, focus on data, not positional stances of I just want this I just want this. That's really hard to solve. Saying, well, I have these puzzle pieces, I have this information, show me yours. How do we fit this together? That works a lot better than saying there's only one way and it's my way. Sounds silly, but often we get sucked into thinking that there's positions rather than just data. One of my favorite ones is if someone else does a position to you and says we have to turn left, and they're not giving you the reasons, ask why. If the doctor says we need to do this course of treatment, ask them why. And if that doesn't make sense, keep asking why. And usually after 4 or 5 whys, you get the real answer. But why is an incredibly powerful word, and having constructive conflicts and finding out why people really think what they do. For example, if you ask a person, why did you think ace was high in the card game? They would say, well, our instructions said so. Oh, it's not you. Ask why. And the final one through all of this and throughout teams in general is the importance of mutual trust and respect. Of your tone of voice, your body language, the things that you say to one another, of always ensuring that you treat each other with dignity and respect, because that makes everything better. So on that note, what we do from evolution, what evolution has made us do as human beings, to be attracted to people that are similar to us, to readily fall into hierarchy, and to ascribe people influence for reasons they don't necessarily deserve. They happen, they're natural, but they're bad for healthcare teams. And it's our job, all of us in a healthcare team, be it a patient, a nurse, or a doctor, to combat these biases and make sure that our teams are more effective at solving tough problems. So the 3 things to remember from today: flatten the cultural hierarchy, treat each other with respect, treat each other as equals, manage participation, let people speak up, help them find a way to have a voice. Manage influence, ensure that everybody knows who knows what in the team, and that you're being a hippo, that you're sinking down enough to let the other people that know something rise up, and that you're managing conflict, that you're managing emotions, you're encouraging constructive debate, so that your healthcare teams can solve the really tough challenges that we're all facing. Thank you so much.